guys, and welcome back to my YouTube channel where we live and learn. So, this is the Health Literacy Academy. If you're new here, karibu sana. Feel free to subscribe to this channel and share this content with as many people as possible. It's the World Hypertension Month, and we are teaching you more about hypertension. So, this time around, we're going to start with the very basics. What comes in your mind when you're told you have hypertension, or when you hear about the condition hypertension? Many people commonly refer this condition to as ugonjwa wa pressure or pressure, but they really don't understand what it is. So Nurse Rose is here to make you understand. So what is this system? It's a system where we have the blood vessels and the heart. We have the heart and we have the blood vessels. What does the heart do? The heart pumps blood and it pumps it to the various organs of the body, or it pumps it to the organs of the body. It can pump it to the brain, to the lung, to the liver, to the kidney, and to the entire body. It supplies oxygen and nutrients through the blood that goes through the vessels. Then it's a continuous cycle whereby that once the tissues and the organs they consume that, they take back the blood back to the heart. So if blood flows from the heart to the organs to the rest of the body, then blood from these organs goes back to the heart, and that is how we keep this system running. So when does hypertension come in? Hypertension comes in when there is a problem either at the heart or at the blood vessels. If there is something that is obstructing the flow here, then you could have hypertension. If there is something affecting the heart, then you could have hypertension. So in the next videos, we are going to discuss which of these are the causes of hypertension. But basically, just you know that hypertension comes in when the normal system is interrupted. Now, often I get people asking me, what is this normal blood pressure? What is normal blood pressure? And what is abnormal blood pressure? So come with me, let us learn. Low blood pressure is when your blood pressure is below 90/60. Some people would ask, after all, it's not high, so what's the concern? I want to tell you that low blood pressure, it comes with its own consequences. It has its own symptoms, it has its own causes, and it's managed per the cause. So it is not good to have blood pressure which is lower than 90/60. And in another video, I will tell you more about low blood pressure. Now, what is normal blood pressure? What blood pressure is it that you could get and you go home smiling after screening and you say, yes, I have a normal blood pressure? It's a blood pressure that is between 90/60 and 120/80. 90/60 to 120/80. That blood pressure in there, it's the 100, the 110. It's usually the best blood pressure. Okay. Now, there is another blood pressure. Called pre-hypertension. This pre-hypertension, it means you are at risk of getting high blood pressure. So this means that you are supposed to be taught on the factors that you're going to keep away so that you don't get the real hypertension. It is between 120/80 to 140/90. Between this time, we are looking at your blood pressure and we think, could it be that you are smoking? Could it be that you've come running very fast and then you took your blood pressure? Could it be that you were sleeping and you stood up and then your blood pressure was taken and you had a high blood pressure? So after we rule out all that and your blood pressure is still between 120/80 and 140/90, then we subject you to a series of blood pressure readings where we we are able to monitor whether you're going to monitor to stay in this, or whether you're going to maintain in this bracket, or you're going to go up, or you're going to come to the normal. So you're going to be taught on how to slow the progression to the other stages. Okay, that's about the pre-hypertension blood pressure. Now, what about the high blood pressure? High blood pressure, we have the stage 1 and the stage 2, whereby our blood pressure is between 130/80 for stage 1, and by stage 2, you are reading around 140/90. So when it's around there, that means for the hypertensive patients who are on treatment, it means that you're taking your drugs well, you're going to your clinic, and you're taking the right dose of medication. So with you having a blood pressure between this and this, 130s and 140s, and you are a hypertensive patient on clinic, then we are very comfortable with you. This is well-controlled blood pressure for someone who is hypertensive and they know it and they are managing it. Now we have another category called the hypertensive crisis. So whenever you hear the name crisis, you definitely know that it's a looming disaster, or it's a disaster already. So when you're having hypertensive crisis, it's blood pressure that's above 180/120. So 180/120 going up, because we still have people who have blood pressure of even 200. So 130 and above, 120 and above, we call that hypertensive crisis. And it means that here is the place where you're getting all these complications coming. Yeah, this is when you can get a stroke, this is when you can get a cardiac problem, or a heart problem. It's a place where you can just collapse at any time. So when you find yourself here having this hypertensive crisis, sometimes it comes in as an emergency. So we get clients who previously didn't know they have hypertension, and then they get to collapse anywhere, and they are brought in at the emergency room. And when we take their blood pressure, we find something like this. So this encouraged me and you to always walk into our health facilities anywhere, get your blood pressure checked, so that you can get to know how to manage your blood pressure and just get to know where you are as per this chart. So I encourage us to go for screening, because high blood pressure is known to us being a silent killer. Why do we call it a silent killer? We call it a silent killer because it will not come saying, "Hello, I'm here." It will not announce that it's here. We are going to discuss the symptoms of hypertension in the next video, but those headaches that you ignore, that dizziness that you ignore, you never know. It could be your only sign to giving you a lead that you could be having hypertension. So quit just buying painkillers from your local duka, and just go to your health facility and have your healthcare worker check your blood pressure. And remember, when you're told you have hypertension, please cooperate and just have your blood pressure managed and adjust your lifestyle. Thank you. Subscribe, share, and like your video. If you have a question or comment or any other topic you'd like me to talk about, please write down below in the comment section. As always, Nurse Rose cares. Thank you.